2, 3.
Hey everybody, this is Dr. Ben Pearl with FitFootU, and today I am here with an old colleague. He used to keep me laughing, Luke Cicchinelli, but he's also a very accomplished podiatrist in Spain. So you've been in and out of Spain 28 years. You practice in North Carolina. I visited you once there. I learned some good practical tips. But you've noticed some things in the health system in Spain, maybe not access to as much secondary and tertiary studies, so the practitioners have learned how to do some good technological studies in their own offices. Maybe highlight some of the Spain differences that you've seen that are useful for us in the US.
Well, so in Spain, the Podiatric Society came to surgery kind of late, and so they learned to develop their skills more in a sports medicine, rehab, kind of diagnostic sense. One technology that's used really frequently now that I haven't seen really here in the United States is thermography. You can basically buy a thermographic camera, attach it to your cell phone. You can screen every patient that comes into the office, and essentially you're looking at temperature change. Basically the differential between one foot to the other, for example, is only 0.3 of a degree. And then in gradations of 0.3 of a degree, you can start to identify a lesion that is not yet problematic, possibly going to become problematic, alarming, now a definitive issue. You can even, for example, look at nerve entrapments, and you'll see that they are a colder area on the foot because it's not an inflammatory issue. It's actually the vasa nivorum has been constricted, and so that will register as cold. So thermography is used as to help mount and dissect out differential diagnoses. There's advances in endoscopy and tenoscopy for diagnostic tools, minimally invasive endoscopic procedures, Haglund's resections percutaneously, even percutaneous Haglund's resection, FHL tendon transfer into the heel, all done through little tiny incisions, ostrigonum resections.
You were telling me in Spain ultrasound's very popular too.
Ultrasound in almost all the offices, basically used preferentially over MRI. Why? Because it's less expensive, more available. It's operator dependent. There's courses all over the place for docs to get trained on, and it's a dynamic real-time exam. Take a look at a plantar plate injury, for example. A runner comes into your office, and these don't have to be surgical cases. This can simply be doing a differential diagnosis, real-time ultrasound dynamic exam where you can actually see the ligaments, plantar plate, lateral ankle.
Quick follow-up on
Achilles
that.
Tendons.
Why do you think, and you practiced in Carolina for over a decade, why do you think that we're so slow to adopt this tool with ultrasound, which to me is like the stethoscope for a cardiologist? Very easy to, you see so much, you see it moving, which you won't see on an MRI. Why are we so slow to adopt? You go to a pro football game, they'll have an MRI in the tunnel, but nowhere have I seen on the field a doc with an ultrasound device to take a look at something.
We're old friends, right, Ben? So
yeah.
you know I'm a straight shooter. American medicine works on the profit motive, okay? In a profit-driven healthcare system, the more tests that get ordered, as long as they're covered by insurance, and that's everyone's kind of bifurcation on the highway. Is this treatment covered? Is this treatment not covered? And they go down the one where it's covered. In a socialized healthcare system, where people are paying out of pocket for certain procedures, especially if it's outside the socialized healthcare system, and podiatric services are a private entity in Spain, you have to pick and choose more carefully, and you have to be very good at what you do because someone's going to pay out of pocket. And different technologies are used more based on actually their ease, their manageability, and not necessarily at all on what's covered or not covered, right down to surgical procedures. American healthcare is kind of over the top on procedures, over-utilization, over-referral, and depending on what products are covered or not covered, profit motive, and that steers in pharmaceuticals.
Sure.
Pharmaceutical industry in Spain is covered within the social healthcare system. A medicine that might cost me here a month, or a geriatric or elderly patient on Medicare might cost them $500 or $600 a month for their pharmacy bill, might cost 5 to 8 euros a month in Spain. So the biggest change is our healthcare delivery system and how that impacts.
Real quick, if somebody wants to take action on the thermography and they want to go a step beyond just those patches that you put that might cost a few bucks where they change colors.
Piece of cake.
Where do they find a good thermographer?
They have to Google who's a supplier here in the United States, but in Spain it's basically a thermography camera, costs you about 500 euros. One of the clinics where I consult at, the guy has an adapter, he plugs it right into his cell phone. Every patient that comes in, we're scanning their foot, and it's fascinating to see. And of course, you're looking at for changes between one limb to the other. Perfect application here in the United States is Charcot foot, or what we used to call stage 0 Charcot. People were taking the old temperature strip off that the anesthesiologist used on the forehead, put it on the foot, take a thermography scan, and you'll have exact.
Sure.
And you can store these images. You can then check it again a week later.
So you can share that data
later.
with your
Oh,
referring
my.
sources.
But you can also
Sure.
archive that data in your clinic.
Yep.
And then that same patient, you could check again 3 days later. Look, healing ulcers or non-healing ulcer.
Perfect.
Thermography. There's even interesting, one of my colleagues differentiates between plantar verruca and IPKs.
Oh, that's cool.
Because the plantar verruca are vascularized.
So
And
warmer?
Exactly. They light up differently on thermography,
okay.
whereas an IPK is just an impacted keratin ball, right? Okay, so it's not necessarily a vascular lesion, and that'll show up colder. You can actually do a differential diagnosis just by thermography of a very common problem for us as podiatrists of differentiating between an IPK or a plantar verruca.
So in summary, if we look at some other tools for less than $1,000, at least with thermography, maybe open up our eyes to doing some ultrasound, we might become more diverse practitioners. Last words, Dr.
Absolutely.
Cicchinelli.
Last
Luke.
words. Remember the musical, My Fair Lady. The rain in Spain falls mainly on the plain, Ben. Don't forget that. My Fair Lady.